And welcome to Deuk Spine Institute. We are broadcasting spine surgery live. Our patient is here from Seattle, but originally Korea, 40 years. He did what I did, married a Korean woman. He's had neck problems, pain in the neck, loss of function in the arms. We've just completed treating his arthritis in his cervical facet joints that was causing horrible pain. We're now going to focus on a disc problem, C5-C6. He has some other interesting findings. He has an auto fusion. He fused himself, C2-3, and he fused himself at he's fusing it himself at C4-5 and C6-7. But 5-6 is not yet fused, and he has a large disc osteophyte complex at 5-6. We're going to go in endoscopically and try to remove as much as we can. To do that, from the right side, because it's on the left, I'm going to access the C5-6 disc percutaneously, and then I'm going to bring in my endoscope. Step one is percutaneous access. Let's go. Shot. All right. 2, 3, 4, 5, 6. I'm too low. I'll get a little bit higher, but it's not bad. Shot. 2, 3, 4, 5, 6. Still low. I have to angle up. Shot. Still low. I'm going to go a little bit higher. Shot. All right, that looks pretty good. AP. We're going to do a quick AP. He's a little tight. How is he on the relaxation side? Shot. Lateral. We noticed in the back of his neck he had severe arthritis. Shot. In the facet joints. Shot. Shot. Perfect. 2, 3, 4, 5, 6. Let's just check a quick AP. Quick. The reason it's quick is my fingers are hurting me very badly. All right, lateral, because I have to push down pretty hard. I am a little off to the side, so I'm going to reposition it and come back. Shot. I went a little bit too much to the other side. Shot. Shot. I like that better. Shot. Let's get an AP. Now, why is he auto-fusing? Why is he fusing himself? For those of you who don't know auto-fusing, the answer is he has some type of an inflammatory condition. I don't know what it is. I don't think he does. The most common we see is either ankylosing spondylitis or DISH, diffuse idiopathic skeletal hyperostosis. But his disc is definitely calcifying. There's no doubt about it. He's already fused a couple, and he's starting to do the same thing here. He's actually fused the one above. Interesting. Huh? There it is. Shot. We're in. So he's already calcifying the annulus up front. Show us the fused disc above. Look at the fusion right there. See, Jordan is showing you with the arrow. You see that, Henry?
Yes, we do.
Totally fused. All right. He has a tear in the back of this disc. You're about to see it. Shot. All right. Let's pull the shoulder a little bit. And shot. There it is. What a mess. Absolute mess. But let's get in and see what we can do. Any questions from our audience? Shot.
At this moment, no current question.
All right. So I've counted to make sure we're in the right spot. I think you're off on orbit, Jordan, by about 1.5 degrees. I'm going to put some numbing medicine so we can numb up the skin. We'll make an incision in a moment. The entire surgery is done with a 4 mm incision. 4 mm, that's all. We just did his Deuk plasma rhizotomy in the back of his neck, which was a 4 mm incision as well. This is in the front. Surgery of this type is generally bloodless and no post-op pain from the surgery. There's no need for narcotics, opioids. Shot. Still off on orbit. Shot. Still off on orbit. Are you making a change? That's I don't know. I can't tell if that's better or not. Shot. Do you see the back of it? I think that's better. Yeah, that's better. Let's just leave it there. What? So you must have, right, you must have overcorrected then. Let's go back a little. 2 degrees. Shot? All right, let's leave it where it is. This is the dilator. We're going to pass this down over the guide wire to spread the tissues apart in an atraumatic or non-traumatic fashion. We will probably lose, shot, about maybe 5 drops of blood the whole surgery. It's not a bloody surgery. There's no blood loss. And there's no damage to this patient's body internally. That dilator will actually spread tissues. We don't need distraction. Thank you, though. The dilator will spread the tissues rather than cutting them. In traditional open surgery, the surgeon will cut your tissues with a scalpel inside you while you're laying there asleep. And while they're slicing and dicing inside you, it's causing bleeding and damage. And all that is what hurts patients, and that's what causes pain. So after surgery, like ACDF surgery, for example, or laminectomy, patients have horrible pain because of what the surgeon did to damage their body. I know that sounds interesting, isn't it? But that is the God's honest truth. The pain people have after surgery is proportional to the damage being done to their body by the surgeon. So when you have a lot of pain after a surgery, that means the surgeon did a lot of damage inside your body. And the reality is the surgeon is going to say, well, I had to do the surgery, right? And that's what we're all taught to do, by the way. We're all taught to do damage to do good. Koreans, they figured out a way to do this surgery endoscopically without doing damage. Is that you? All right, that's it. I want you to appreciate the angle. It's not straight in, it's angling up. His neck is fusing in a kyphosis forward. I can't do anything to prevent that. Nobody can. And correcting that is unnecessary at this point. It won't help him, but it's also extremely morbid, meaning very high risk of complications and problems after surgery with, deformity and pain and, hold on, non-union. Is that us? Yes, sir. All right. So I've got to get his tube down all the way. We're only fixing one disc. How's he doing? Great. We're only fixing one disc. That's the disc I'm at. Remember, the other discs are pretty much fused themselves. This is the one that hasn't fused, so... Here we go. I'm going to now advance. So you see the dilator came back. So this disc is still soft. It's not fused yet. It may never fuse. Sean? Ooh, there's a lot of pressure. All right, that's good. That means he's going to do well with the surgery. The pressure is a sign of inflammation. And inflammation means swelling. Sean? Every time I You guys see that? When I let go of the dilator, it shot back in. That's because there's pressure, like swelling in here. And it's pushing, trying to find a way out. And it's pushed the dilator out the tube to relieve the pressure in itself. I don't know if you understand that, but that's what's happening. Shot? Oh, see that? I didn't do anything. It already, like a bullet, it pushed the dilator back. There's so much pressure in here. What's causing there shouldn't be pressure, by the way. What's causing the pressure is the inflammation. All right, well, this is a good sign. I like seeing this. This means we can help him. Any questions?
At this moment, no current questions.
Let's show our video on why do these disc herniations cause neck pain. Because it's the number one cause of neck pain. Chronic neck pain is a disc herniation. Number one. All right, welcome back. You can see how a disc herniation causes pain. And the reason is right here, this tear. You guys see a tear down there? This tear is what I'm cleaning with the laser. And it's the tear that causes neck pain. Quite simply put, it's the tear that causes neck pain. Now, a tear itself doesn't cause neck pain. Inflammation in the tear causes neck pain. And how do you get inflammation? Well, the answer is you need a herniation to get inflammation. You can't have inflammation without a herniation. So if your tear occurs and then your body heals it quickly without getting a herniation, then you won't have neck pain. You'll just heal your tear. On the other hand, if you get a tear in your annulus and you herniate, then you're going to get neck pain. You're going to get inflammation. Okay? Any questions?
At this moment, no current questions.
This has been going on for a while. You can tell there's a lot of scar tissue, look at all the white stuff, calcium. And when I hit that stuff with a laser, it turns gold. Golden color. You guys see that? That tea color? Golden color?
Yes, we do.
That is calcium. The only way you get calcium is from chronic inflammation. Inflammation's been going on for years. Doesn't happen if you have just inflammation for a few days or weeks or months. You need years and years and years of inflammation. So this has definitely been going on. Now, I don't know what kind of neck injury he's had. He's from Seattle. He lived in Korea for 40 years. I was talking to him. He has a lovely wife. She's Korean. And you know, I don't know when he injured himself, but I could tell you this injury is not new. This is an old injury.
20 years of pain.
He's been in pain for over 20 years. So maybe it happened when he was over in Korea. Something happened. I don't know. Yeah. A lot of times patients will not remember the trauma that set off, you know, everything. They will only remember when the pain started. And I could tell you, the pain usually does not start at the time of trauma. It usually starts later. So most people will get a disc injury from trauma and then not have pain for a while, and then they get pain. Years later, months later, it's very common. Now, the companies like State Farm and Geico love to say, oh, your pain didn't start and for a few months, so it's not related to your accident. Well, that's not true. It is related to your accident. Why is my foot getting wet? All right. The dog in the operating room decided to go to the bathroom on my foot. I'm just kidding. We use cold irrigation. That cold irrigation keeps the tissues from burning. That's why we don't have fire in here, thank God. And it allows me to work with the laser and remove all these bone spurs I'm removing. This is a good one for bone spur removal. You know, people ask me, can you remove bone spurs with the laser? Yeah, I'm doing it right now. All right, any questions, Henry?
At this moment, no current questions.
Let's show a video on how the Deuk laser disc repair works. Have we already shown that one?
Not yet. We have shown the neck pain. I'm currently showing cervical DLD.
And we'll come back. You can see how the procedure actually works. It's called the Deuk laser disc repair. We go into the disc all the way to the back where the tear is and where the herniation is. And then I use a laser to clean everything out, get rid of as much of the herniation as I can. You don't need to get rid of a lot. You just need to get rid of the right part, the part that's causing symptoms. Okay, you got to be strategic. You know what I mean? 2 minutes. Our patient is under general anesthesia. He's asleep. And because of that, I'm talking to my anesthesiologist. We're trying to figure out when we should wake him up, how much more time the surgery will take. Because you don't want to have somebody asleep for any longer than they need to be. Being asleep under anesthesia is not a good thing. Your body doesn't really like it. It's necessary to do surgery, but it's not something you want to do any longer than you need to. All right, just about finished. I'm going to look around here and see if I can find any more pieces of herniation that I can get rid of. By the way, this is the posterior ligament, that white area just below where I'm working. There's another little piece of herniation. We got at least probably 5 or 6 good sized pieces of herniation out. Some of them are so dense they just don't even want to come out. They're full of calcium. Calcium makes them weigh more. So instead of coming out, they just sink like a lead weight. That's all bone spurs. And you can see how it's so white. That's because it's just cortical bone, solid. There's no diploic bone there. That's bad stuff. But it's not causing any problems for the patient here, so I'm going to leave it alone. I'm only going to treat what needs to be treated. The laser is precise to 1/20th of a millimeter. That's a millimeter divided by 20. All right, this should be the last herniation coming out, and we're done. All right, we're done.
Sitting up, please. Thank you.
Any questions?
At this moment, no current questions.
I will come and answer them. Type them up if you have them. Otherwise, I hope you enjoyed our broadcast. This was done with a 4mm incision. Our next patient is having a thoracic Deuk laser disc repair. Thoracic is your thoracic spine. And I'll be doing his thoracic spine. What are we doing? T5-6? The number T5-6. 5-6. That's the number 5-6 disc in the thoracic spine or T-spine. Other countries call it the D or else the D-spine. In America, we call it the T-spine, but elsewhere it's known as D. Take your time.
Yep.
You guys see the incision is just 4mm. It's pretty much bloodless surgery. Henry, can you see okay?
Yes, we can.
Please, can you figure out that?
There's the incision. See it?
Yes, we do.
4mm. It's kind of hard for me to even see the incision right now.
Thank you so much.
Scope use is a 5. Thank you. Type your questions up. If you have any, I'll come answer them for you. Thanks for watching. I'm Dr. Ari Deuk with the Deuk Spine Institute. We have a patient who just had surgery yesterday. And if you were tuned in online watching our live surgery broadcast, you saw her get 2 discs fixed in her neck. She's had a prior fusion done with an ACDF and a metal plate, so we fixed the disc above the fusion and below the fusion. She had adjacent segment disease. And how long were you suffering with neck pain and right arm symptoms before you came to Deuk Spine to get it fixed yesterday?
Over 20 years.
Over 20 years.
Over 20 years.
And you had the Deuk laser disc repair done. You can see we had to make 2 incisions on the front of your neck. How do you feel after the surgery you had yesterday?
Awesome. Never felt like I've not felt like this, and I couldn't tell you how many years. I've not been able to actually have a normal life due to the pain. Hurting so bad, having to lie down during pretty much after lunchtime.
Do you still have that pain right now?
No, sir.
It's gone.
Gone, yes.
Yeah, your neck is still a little stiff, and you
Yes.
got to get used to that. But you did have the fusion, fusions always cause neck stiffness, and we can't fix that. But the pain we can fix. So the pain you had before is gone.
Yes, sir.
You happy?
Very, very happy. That's an understatement.
Now you have a funny accent because you come from Bluff City, Tennessee. Isn't that right?
Yes.
All right. And why did you travel to Florida for your surgery?
Done a lot of research, and then I found you. Thank God. Greatest blessing that I've ever had. Best doctor I've ever been to in my life.
Thank you.
I can't really put into words how I feel. It's beyond. It's the greatest blessing ever. It truly is.
Well, I'm glad you're doing well. I know your husband is here. He's been very supportive. He was here throughout the surgery yesterday, and you can actually see in the video footage that we made 2 tiny little 4mm cuts in the front of your neck, went down through the neck, not damaging anything inside, and getting to the herniations where the tears were. And actually, you could see the tears on the discogram that I did and they were big. And we were able to get in there and clean out all the herniations with the laser. And we didn't have to do fusion anymore. We didn't make your neck any worse than it came here with. And the nice thing about the Deuk laser disc repair is it's a stabilizing procedure, getting rid of pain and neurological compromise. I checked you today. You came to us with weak arms, and now you have normal strength in your arms just 12 hours, 24 hours after your surgery.
Yes. Not had that in so many years. So many years.
All right. Well, is there anything else you want to say to your fans out there?
Anybody suffering with chronic pain, you have no idea. It is well worth coming to see. Like I said, he's the best doctor I've ever been to in my life. He actually cares. First doctor I've ever had in my life to hug me and ask me how I'm doing.
And compliment you on your nails.
Exactly. He loves my nails.
I
He
do
loves
love
my
your
nails. Highly recommend him, like I said. Very well worth everything. He truly does care. And the team here is awesome. The nursing staff, everybody was tremendously, I can't express enough how everybody was so good to me and just went out of their way to make sure that I had everything I need. I was comfortable. You know, it was just a very wonderful experience. It truly was.
And I appreciate you sharing. You also had the Deuk plasma rhizotomy, I just remembered, because she had facet joint pain as well as the disc problem. And she was having pain turning her head to the right, weren't you?
Oh yeah, I was having extreme pain. I was turned into when I couldn't hardly turn to my right. It was going down into my right arm extremely bad.
And that's gone.
Yes.
Amen. And it's gone permanently. So I'm very happy for you. When are you heading back home?
Saturday morning.
All right. Well, enjoy Florida for a few more days. You take care of yourself. You've got my phone number if you need anything.
Yes.
All right.
I thank
take
you
care.
so very much.
You are more than welcome. It's my pleasure to take care of you.
Even with my funny accent.
All right. Let's get you out of here, okay? Go enjoy the beach or something. And good morning, I'm Dr. R. Deuk Majan, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients who's traveled far to come to Deuk Spine Institute, all the way from Michigan. What brought you from Michigan to Florida?
I was scheduled for fusion to have just my one disc, C5-C6 fused. I'd had disc herniation before in my lower back, had it done. I didn't want to have to go through that again. So I did some research, found you had a good record. Your history is impeccable, so I decided to come down here and have it done.
Well, you didn't have a fusion, though. You had something else done.
Yeah, I'm sorry. So instead of fusion, instead of going through and the complications and risk of fusion, lack of mobility, I wanted to have laser. I talked to somebody in Mexico that had laser surgery, and she said it worked great. So I thought I'd pursue that avenue, and that's when I kept Googling and searching and trying to find the right place. Some places had bad references. You had impeccable record, so this is why I came here, and I'm glad I did.
Yeah, so you were recommended for fusion by another doctor, and let's talk about that for a moment. They were going to fuse one disc, right? Number 5-6?
Correct.
Now, if you go to your surgery video here, you could see that we made a tiny 1/4 inch, 4mm incision. And we fixed 2 discs, not 1, but 2. And it turned out that the disc that you were not going to have fused was actually the worst one. It was the one that was causing the vast majority of your symptoms. And the reason I'm talking about this is it's a common problem. It comes down to being misdiagnosed. And misdiagnosis happens all the time, all over the world with spine problems. And that's what we're trying to fix, is not having patients get the wrong diagnosis, because the wrong diagnosis will lead to the wrong treatment. Because treatments are always based on diagnosis. So if your diagnosis is C5-6 disc, the treatment will be fusion of the C5-6, but that's wrong because you had 2 discs that were problematic. We fixed both. You could see in that video, we were taking out lots of little chunks of herniation out of your C6-7 disc. Definitely needed to be done. How do you feel today?
I feel great.
Yeah, do you still have the same neck pain you had when you came here?
No, my wife can already tell that my shoulders are relaxed. My neck, I feel great, so very comfortable.
And you had your surgery just 24 hours ago.
Yesterday morning.
Yep, and you can see you have a tiny 4mm incision with a Band-Aid. No metal, no fusion, no narcotic painkillers after surgery. We didn't give you opioids, so that's another plus to the Deuk laser disc repair.
I agree.
Yeah, you don't need to be on powerful painkillers. You're back on your feet already, walking around, not in the hospital.
Yep, Great. I'm glad I had a guardian angel looking after me.
You did have a guardian angel, and you're welcome. We enjoy helping people like you have successful spine surgeries. Is there anything else you want to tell your fans out there?
Basically, if you need the surgery, if you're having complications, neck, back, definitely come here. I don't care what it costs you for travel or whatever. You can't, it's worth, priceless.
I agree with you. It is priceless to get out of pain and have no complications from your surgery and nothing bad that hurts you or harms you or changes your life in a negative way. So congratulations. And when do you guys head back to Michigan?
Saturday.
Saturday. So you're going to spend a few more days here?
Yes, sir.
What are you going to do for the next couple of days?
Well, we plan on hanging out in the sun, but
Yeah.
it's not the case right now.
I think, yeah, well, you could do. Oh,
I
yeah,
have
it's a
some
little
already.
overcast right now.
Yeah.
But this would be a good day for you to go check out the Kennedy Space Center. It's about 10 minutes away. They have all the displays and history of NASA, and it's really worth visiting.
I'll do that.
Save the beach for tomorrow.
There you
A
go.
sunny day.
All right.
All right,
Thank you very much.
congratulations. You're
Thanks,
welcome.
Thanks again.
All right, and hope you enjoyed that video as much as I did. It's always nice to help people get out of pain, and we have the most advanced technologies in the world in terms of diagnosing pain and curing pain here at Deuk Spine Institute when it comes to spine pain and most likely orthopedic pain, including knees, hips, and shoulders. So this patient that we just finished up traveled here from Seattle, Washington, across the country with his lovely wife from Korea, and he lived in Korea for 40 years as a contractor. Anyway, he's here because he had horrible pain in the neck. He's got several things happening that were inconsequential and not important in figuring out how to treat him. However, the key issues for him were he had one disc that was damaged, causing pain and also impinging on the nerve with herniations and bone spurs. And we had another problem with facet joint pain where he had pain at the base of his neck with extension and rotation. Turns out he had horrible arthritis of the joints called facet joints. And just so you understand what are facet joints, they're small joints located in the back of the spine. You have them in your neck, in your thoracic, and your lower back.
There we go.
Why is it so blurry?
I don't know. It's fine a minute
Weird.
ago.
All right, let's see if we can fix this blurriness. I'll let Henry do it while I talk.
Do my magic.
Well, if you have questions about the pain, just go back and rewind and watch our little videos throughout the surgery on the facet joint pain and how we treat it with what's called the Deuk plasma rhizotomy. All right, we're going to take our first question. I apologize
Yeah.
for the blurriness.
I apologize,
Try it one
too.
more time.
One more.
Is it on autofocus?
It should be.
Leave it.
Yeah.
Leave your hand.
Kind of. It's worse. Dang it. I
All
apologize,
right,
guys.
well, here, maybe I'll just.
Yeah, you can do it like that.
All right, let's try. Let's try this.
That's perfect, actually.
Right here. Okay.
Perfect. All
Go
right,
ahead.
this is the first question coming from Tracy on Facebook.
Sorry, up close and personal.
Asking, curious when you do a piriformis release, what happens to the muscle that remains unattached to the gluteal area? Assuming it might drop a bit in the gluteal area, are there concerns about the sciatic nerve further scarring around the piriformis or mechanically pulling on the sciatic nerve? Also, what might be your guess on the length of time for the areas of attachment to heal?
Yeah, so number one, the muscle doesn't drop. It just pulls away and sits there in your body. Number two, it doesn't scar or contract on the sciatic nerve. And number three, how long does it take to heal? Everybody's different. Some people it's, days. Some people it's weeks. Some people can even be a little bit longer, like months. But it never causes long-term issues. Next.
That is it for questions.
All right, I apologize about the camera.
I apologize.
We got to work out the bugs, but
That's for the next one.
hope you enjoyed surgery, and we'll be back with a thoracic DLDR,
Yes.
right side T5-6, and also a cervical DPR, Deuk plasma rhizotomy for facet joint pain. Once again, thank you, and over and out.